Welcome to the Kane Education YouTube channel. Today we will discuss about the blood pressure. That may be different parts you will occurs. Okay, so in this blood pressure part one, we'll discuss something like definition, components, and others also. So in the definition, what is the definition? It is saying about the blood pressure is a lateral force exerted by circulating blood. So I will tell you the here there is a what we are telling about what this is ventricles. Okay, so the ventricles and this is a pulmonary artery. Okay, or you can see that maybe in the left side, left ventricle will move, the blood will move towards the which blood vessel, that is aorta. Clear? Now in the valve, in this valve, okay, in this valve blood has to get inside. So with when it moves inside the lumen of the arterial wall, the pressure which is exerted due to the ventricular contraction, so due to the ventricular contraction it exerts the force on the arterial wall, so that one will be called as systolic blood pressure. Please do remember, this one is the forward pressure, this one is forward pressure. Clear? Okay, so forward pressure will be said as what? Systolic blood pressure. Understood? Now we will come to the this exact definition. The blood pressure is a lateral force exerted by the circulating blood on the walls of the arteries due to the ventricular contraction and ventricular relaxation. Okay, so systolic blood pressure is pressure in the arteries during the ventricular contraction. During ventricular contraction means systole. So here the normal SBP, see, when it goes there is a opening, there is a opening of the valve. Here the pulmonic valve will be there, pulmonic valve will be there, and in the left side aortic valve will be there. So the aortic valve, if it is open, that time forward pressure will be exerted by the left ventricle, so that one is a systolic blood pressure, and this one is also systolic blood pressure. At a time the ventricular, both ventricles will contract, so that is ventricular contraction, right? So that due to the ventricular contraction the force is exerted on the arterial walls, right? So that is systolic blood pressure. How much, sir? It is about 120 mm of Hg is the normal. Diastolic blood pressure, so diastolic blood pressure means what? When the pulmonic valve is closed, when the pulmonic valve is closed, or when the aortic valve is closed. Okay, when the aortic valve or pulmonic valve is closed, so here what happens, the blood, okay, the blood which is already in the forward movement, so due to the absence of ventricular contraction, there is a ventricular relaxation. Already contracted ventricles, what happens, it will comes back. Okay, so what it will do, it will comes back, right? So it that time when due to the ventricular contraction, due to the what, due to the ventricular due to the ventricular relaxation, there is a decreased in the pressure. Okay, and that what the bloods will exert the pressure on the arterial wall during the ventricular relaxation, that one will be called as diastolic blood pressure. Okay, I hope you understood this one. Diastolic blood pressure will be 80 mm of Hg, which is lesser than systolic blood pressure. Always it will be lesser than systolic blood pressure. Clear? Okay, what is the normal BP range? We you people know very well, 90 by 60 to 120 by 80 will be the normal range. Okay, less than 90 by 60 will be said as what we can say, this one will be said as hypotension. What we say? Hypotension. More than 120 by 80 will be said as hypertension. Sir, we should not say hypertension. Yes, you are good. What we should say? We should say if it is more than 120 by 80, there is a chances of pre-hypertension. Okay, sir, you are telling about chances. We need exact. Okay, 130 by 85, more than 130 by 85 will be called as pre-hypertension. Pre-hypertension. Sir, what about real hypertension? More than 140 by 90 in two situation. In two situation, this one will be called as hypertension. I hope you understood this. Okay, so now we understood everything about the normal BP range and abnormal BP range also. What are the factors that will affect the blood pressure? This may ask the question in your exam. So age, as the age okay, as the age increases, what happens, the BP also increases, and pulse pressure pulse rate also increases. That you should remember. In exercise also increases the BP, emotions also increases the BP, pain also increases the BP. What are the factors that will affecting the BP, right? So posture, that posture, example standing, standing will decreases the BP, please do remember. Okay, sitting will increases the BP. Okay, yes, sleeping will decreases the BP. Next, obesity will increases the BP, pregnancy will increases the BP. Drugs depends whether you are taking the hypotensive drugs or whether you are taking the hypertensive drugs. So that will depends. In the drugs it will depends. In the smoking, caffeine and alcohol, 100% it will increases the BP. Disease condition, that also depends, but most of the cases will increases the BP. This much if you written, you will get out of it. Next, importance of the measuring the BP. In this it will detects. Okay, first how you have to write. First one you can write the detects the hypertension, second one you write detects the hypotension. So first one is detects hypertension, second one is detects the hypotension. You got 2 points. Next, monitors the cardiovascular status, that may be tachycardia, that may be bradycardia, that also you can monitor. Okay, so tachycardia and bradycardia will be identified through the pulsar. Yes, you are correct, but I said BP and pulse will be inversely proportional, isn't it? If the increased BP, if it is there, sorry, increased pulse rate if it is there, it is due to decreased BP, as I said. Okay, so some, in some conditions the that this may not possible. I will tell you the that type of conditions when you are getting higher studies, right? So monitors cardiovascular status, guides the treatment decisions, whether we need to give the correct dose or correct right dose or right drug. So which drug we need to give, so which type of patients we need to give, that also guides, right? Prevents the complications like stroke, we can say that is cerebrovascular accident, myocardial infarction, shock, especially the cardiogenic shock, hypovolemic shock, very importantly hypovolemic shock. In the hypovolemic shock, what happens, decreased BP will be there, increased heart rate will be there. Clear? Okay, this is the importance of the measuring the BP, right? Next, coming to the purposes of the BP assessment, for the baseline assessment, for the early detection of the disease condition, whether it is hypertension. So hypertension will be called as silent killer. What we call hypertension will be called as silent killer. Clear? Okay, to monitor the therapy response. Okay, that means you give an anti-hypertensive drugs. Anti-hypertensive drugs means the drugs which will against the hypertension you given, but in order to check whether it is done their activity, done the correct what we can say for that, correct mechanism or not. Okay, I will change, I will make it. Okay, is that made correct mechanism or not? Okay, so that one will be said by doing the monitoring of the BP, right? So assessing the emergencies, routine health checkups. So these are the purposes of the BP. Next, coming to the types of the BP, we know that systolic blood pressure is 120, diastolic blood pressure is how much, 80 mm of Hg. Pulse pressure means what, difference between systolic blood pressure and diastolic blood pressure. Okay, next, mean arterial pressure means diastolic blood pressure. Okay, diastolic blood pressure, and also what will be that, so plus, okay, plus systolic 1 by 3 of pulse pressure. Okay, 1 by 3 of pulse pressure. Understood? So this will be the answer. Clear? So what is the mean arterial pressure? What it is saying exactly in one cardiac cycle, in one cardiac uh, output, in one cardiac output, one cardiac cycle, sorry, in one cardiac cycle. Okay, in one cardiac cycle, what will be the arterial wall pressure? Arterial wall pressure. So that will be identified by mean arterial pressure. How much, sir? It is the normal 70 to 100 mm of Hg. Okay, this is the normal mean arterial pressure. What is the normal pulse pressure? 40. How, sir? 120 is the systolic blood pressure. Okay, and 80 is the diastolic blood pressure. 120 minus 80 is 40. Clear? Okay. Next, coming to the pulse pressure. Pulse pressure difference between the systolic diastolic, as I said. Okay. Next, mean arterial pressure. Here the average arterial pressure during one cardiac cycle, as I said. Okay. So it is dBp plus 1 by pulse pressure. See, dBp plus pulse pressure means what? dBp SBP minus what? SBP minus dBp divided by 3, right? So this is the, you can write like this also. Clear? Okay. Next, equipment for the BP assessment. What all the equipment is needed? We need sphygmomanometer. Here there is a sphygmomanometer, right? We need steth. Okay, you all know about steth, isn't it? Stethoscope. We need appropriate cuff. For adult patient we need adult cuff. For infant we need infant cuff. Okay. Next, alcohol swab. It is needed to to what? To make the disinfect of diaphragm. Diaphragm means not the respiratory. Okay, diaphragm of a steth, and also we can say that is earpiece or ear plug of the steth. Okay, steth. Clear? Okay. Record sheet will be there, that means documentation, for the documentation purpose. Okay, these are the equipments that you need for the BP assessment. Please remember these things. Okay. Next, coming to the parts of the sphygmomanometer. So as I said, this is the mercury gauge and this is a mercury manometer overall, and here this overall, this one will be called as box case. Okay. Here there is a lock, outer lock. This one is outer lock. I will make it. Okay, this one is outer lock, and here there is a inner lock will be there. I will take white. Here inner lock will be there. This is lock. Okay, and this is unlock. Okay, this is unlock. So whenever you are doing the procedure, make sure it is unlock. If you are pumping the rubber pump, see here, this is the rubber pump, right? This rubber pump, when you are pumping, please make sure it is, this one is unlock. Otherwise what happens? The mercury will never rises up. Okay. Next, this is the rubber tube. This one is also a rubber tube. This is adult cuff. Sometimes it will be called as bladder. Okay, bladder. Clear? So it will be bladder, BP cuff. Okay, I'm sorry, this one will be not called bladder. Okay, this one is rubber pump, right? This one is rubber pump, and this one is cuff. This one is lock. So this one is tubing, right? So mercury will rises here. Next, cuff, inflatable bladder. So this one is inflatable bladder. Okay. Okay, this one is inflatable bladder. Next, this one is rubber pump, or we can say bulb. What we can say? Bulb. Clear? Okay. Okay, here there is a, you can see the valve, that is valve. You can anti-clockwise, clockwise and anti-clockwise. Okay, clockwise if you are rotating, that will gives you airtight. What it will give? Airtight. Anti-clockwise will gives you air release. release. Okay, pressure gauge will be there in the sphygmomanometer. Clear? So what are the types of sphygmomanometer? This is the mercury sphygmomanometer, manometer, sphygmomanometer. Okay, next this one is aneroid. So this type will be there na, it will be called as aneroid manometer, and this one is digital. So one thing I would like to say, which one is most accurate, which one is the most accurate? Mercury. Clear? Which one is the highest cost? Mercury. Clear? And most commonly used is digital. Most commonly used is digital. So which one is the least used? That is mercury. Clear? Okay, next, BP, principle of BP measurement. What? Based on what? So based on the oscillation also it can be done. Okay, occlusion and gradual release of arterial blood flow and detection of Korotkov sounds. Based on the Korotkov sound also it will be done. Clear? Next, Korotkov sounds. What is the meaning of Korotkov sound? Sound heard during the cuff deflation. When you are releasing, when you are doing the anti-clockwise rotation of the valve, that time you are deflating very slowly. Sir, how much speed we need to deflate? 2 to 3 mm of Hg per second. You need to deflate. Don't do it fastly. Clear? Okay. That time the flowing of the blood, the speed, okay, the turbulating in the lumen after the removal of the pressure from the artery when you are deflating, isn't it? That's what you will get the sound, right? So that sound will be called as Korotkov sound. So in that Korotkov sound, certain sounds that is heard. Okay, so you read this definition as I said in the explanation. Clear? So tappings, what are the phases? There are 5 phases. There are 5 phases. Okay, in the first phase it will be systolic blood pressure. Okay, in the second there is a flow of the blood will be called as swishing sound. In the third you will get some loud sound, that is knocking sound, but it is not stronger than the systolic blood pressure. Clear? And fourth one, you will again, you can hear the muffling sound. What you will hear? That is muffling sound. So muffling sound where we can hear, that is in the children and also in the pregnancy. Okay, so next fifth one is a silence. Okay, and this one will be considered as diastolic blood pressure. So there is a appearance of the sound. Okay, there is a you should not say appearances, sorry. Okay, so for this, very importantly, keep remember, systolic blood pressure we need to say that is reappearance sound. What we should say? Reappearance of the sound. Clear? Systolic pressure indicated faint clear tapping sound that gradually grow louder. Okay. Okay, yes. So murmur of the swishing sound that increases as the cuff deflates. Okay, murmur swishing sound will come. Clear? Next, in the phase 3, louder knocking sound that occurs with each heartbeat, that is due to the ventricular contraction. Clear? Next, muffling sound, a sudden change in the sound that may be due to the slow, that is due to the already due to the lesser sound. Okay, lesser sound. Muffling sound indicates the diastolic blood pressure in children, also pregnancy also. Next, phase 5, silence, disappearance of the sound that will make sure the marks the diastolic blood pressure, right? Okay, next, here is the Korsakoff sound: 140, 130, 120, 110, 100, 90. Okay, so where you will hear the sound, you may hear the sound at 140 also, you may hear the sound at 120 also. When you hear that, that is reappearance sound. Okay, so reappearance sound is how it will be: thump sound. What we can say? Thump sound, sharp thump sound. So if it is swishing sound, will be called as blowing sound. What we can say? Blowing or whoosing sound. Okay, In the third one, what we can say for the third one, louder knocking, okay, louder knocking, but softer thump. As I said, it will be softer thump, don't write thumb, okay, thump. Next, in the this one is the first one is reappearance, systolic blood pressure, thump sound. Second one is swishing or blowing or whoosing sound. Third one is a louder knocking and softer thump than the first thump, okay. Next, fourth one is the softer blowing sound, okay. Next, fifth one is a silence. That silence is called disappearance, okay. What is a disappearance? So fifth correct sound. So when we will assess from where to where we will assess the BP, very importantly, from the cortex of 1 to cortex of 5. This is very important, clear? Okay, we'll see tapping sound, swishing sound, loud tapping sound, muffling sound, and disappearance. Next, systolic phase 1, diastolic phase 5, phase 4 in children, very importantly. Phase 4 is the disappearance for them. Next, patient preparation. Rest them 10 to 15 minutes if they are done any exercises or walking, okay. So patient preparation means pre-procedure. I am sorry for the pen, okay. Pre-procedural, okay. Avoid caffeine or smoking, if they are taken, avoid the BP monitoring about 30 minutes, okay. If they took exercise and there is no rest, means 10 to 15 minutes is enough. But if they took coffee or smoking, that time you tell them to take rest, or without smoking or caffeine for 13 minutes, okay. 30 minutes. Empty the bladder if they have urgency, or if the bladder is full, okay, bladder is half or full, so they need to empty the bladder. Next, sit relaxed for the sitting position. If they want to sleep, they can sleep if it is not contraindicated. Arms supported at the heart level. Some students are doing sitting on the bed. You should not sit on the bed, no. If you sit on the bed, and if you do, okay, so volunteer will be sometimes they will sit on the bed, you should say sleep, otherwise you should make them to sit on the chair. Later on, you should confirm whether it is heart level or not. What? That is sphygmomanometer. Whether the sphygmomanometer is a heart level or not, you need to check. Next, palpatory method. Palpate the radial artery if the stent is not there. If the stent is not there, you should mention that one. Inflate the cuff until the pulse disappears, okay. So you inflated, that means pushing the hair up to 120, still you can hear the sound, so that again you need to push the hair up to 150, that means up to more than 30 mm of Hg, that can above the hearing sound, above the tapping sound, you can say above the tapping sound, clear? Okay. Deflate slowly. What is the rate? 2 to 3 mm of Hg per second. Reappearance means that is SBP only, clear? Okay. Auscultatory method procedures. Place the stent where brachial artery. Inflate the cuff 20 to 30 mm of Hg above. Deflate the cuff 2 to 3, as I said. Phase 1 is SBP, phase 5 is DBP, clear? Okay. So in the next video we will discuss further. Thank you.